How can you avoid high altitude sickness?
This is probably the most important question and answer of the talk. Fortunately, it's relatively simple. The best way to avoid altitude illness is allowing your body time to adapt to the low oxygen environment, and we call that acclimatization. So the best way to do that is to gradually go up in altitude. So there's lots of guidelines out there that have been put together by kind of expert panels of doctors and other medical professionals in the world of altitude medicine, and mountain guides as well. And they've come up with a suggested sort of level of ascent, so maximum ascent of going up in altitude, basically. And it's, for most people, it's sort of 300 to 500 meters of ascent per day over 3,000 meters. And then every 3 to 4 days having a rest day where you wouldn't go up at all. And it's just to allow your body to naturally acclimatise. Now, for lots of mountains, that's not really, it's very difficult to stick to those numbers exactly, because, mountains don't come in perfect levels. Sometimes the path takes you a little bit higher or a little bit lower or whatever. But as long as the average of your trip is not going up more than 300 to 500 meters every few days in sleeping heights, you might be able to go up a bit higher than that. Say, for example, if you needed to cross over a pass, but then you drop down the other side and then sleep a little bit lower. So gradually ascending, not rushing up, and having a rest day every few days where you don't go up any higher. It's also, the other important things are just the basics of looking after yourself. So making sure you're staying really well hydrated, drinking plenty, fueling yourself with enough calories for whatever activity it is you're doing, because it's really hard work to be at altitude. And of course, if you're doing exercise as well, trekking or, whatever, you're going to need lots of fuel. So lots of good, tasty food, trying to get as much sleep as possible. And looking after yourself, listening to your body as well, and noticing how you're feeling, and noticing if you're starting to feel worse or if you're actually getting better, and just paying attention and looking out for whoever you're with as well. If you're with other people, your friends or whatever, just checking in on each other and making sure that everyone's okay.